Hello guys, you're welcome to our Simple Fitness channel, where we talk about staying healthy and living the youthful life at all time. Please subscribe to get more tips and guide on staying forever young and healthy. Also, don't forget to tick the bell notification icon so you don't miss an episode as we drop healthy tips every day. Like and share the video if it makes any meaningful impact in your life. Today, we shall be talking about getting a keloid medically removed. 1. Ask your doctor to examine the keloid. If your keloid continues to grow after you've taken steps to stop it, get a medical examination. The doctor will look at the keloid and take your medical history to determine the cause of the keloid. The doctor will then discuss removal options. If the doctor suspects that the keloid is growing because of another health issue, they may want to do a biopsy. The doctor will remove a little of the tissue and look at it under a microscope to see if there are cancerous cells. 2. Try cryotherapy to freeze off the keloid. If you have a small keloid or several small keloids caused by acne, ask your doctor about cryotherapy. The doctor will inject liquid nitrogen into the keloid, which will destroy the keloid from the inside. You'll need to repeat the treatment every 20 to 30 days until the keloid is removed. Keep in mind that cryotherapy can lighten the skin. 3. Get surgery to remove the keloid. Your doctor might recommend surgical removal if the keloid is large or doesn't stop itching. Keep in mind that surgery can cause other keloids to form, especially if you're predisposed to developing keloids. To prevent this from happening, you'll probably need a combination of treatments, such as surgery and corticosteroid injections. Remember to follow the skin healing steps to recover from the keloid removal surgery. Tip: check with your insurance company to see if keloid surgery is covered, since some companies view it as cosmetic surgery. 4. Try laser surgery. The dermatologist will direct a laser at your keloid, which will release a pulse of energy. This energy will make the blood vessels in the keloid become smaller and will eventually cause it to disappear over the course of a few treatments. The laser will also lighten the color of the surrounding skin. 5. Avoid dermabrasion, which could cause more keloids. Physically removing the keloid by sanding or scraping it off damages the surrounding skin tissue. This can cause more keloids to develop as the skin tries to heal. Treat the skin around your keloid as gently as possible to avoid further irritation. Thank you for staying tuned till the end, and don't forget to subscribe if you have not already done that. Also, drop your comment below if you have some more tips that will be useful as well. Until next time, drink more water, eat right, and sleep tight. Goodbye.